Hi, good afternoon, everybody, and welcome to our Q4 of 2023 Federal Committee of Practice call. And thank you all for giving us the time today to, as we celebrate one of our VA partners, the San Diego VA Medical Center, as they're going to demonstrate how they conducted a renaissance to increase utilization, and then also talk about how through the renaissance they identified one of their hotspot trouble spots and the people, process, and technology they put in place to achieve an outcome of reducing heart failure readmissions within the facility. And so before we get started with the content today, I just want to go over some, if this is your first time using the Zoom webinar, just some housekeeping around that. So by default, everybody is muted, once the webinar began. So if you would like to ask a question, if you notice down at the bottom of your screen, you'll have a Q&A box. At any time during the webinar, go ahead and as a question comes up, go ahead and type it into that box. And then at the end of each of the presentations, we will have a time set aside, about 5-10 minutes where we can answer any questions that might come up during the presentation. And at the end of the webinar, we do have a brief survey that we would appreciate you all to fill out to see how we did on the webinar today and kind of gather some feedback around future webinars moving forward. So without further ado, before I actually get to introducing our special guest, I want to introduce our founder and CEO, Michael O'Neill, who has joined us today, and he's asked for a little bit of time today to talk to our government partners out in the field. So Michael.
Hey, thanks, Carl. Hello, everybody from Washington, D.C. This is where I live and Get Well Network is based. For those of you who have not met, again, I'm Michael O'Neill. I'm the founder and CEO here at Get Well Network. We are just over 23 years kind of into our work at Get Well, and now about 15 years into our work with all of you and working with you and our veterans. Today, our work with you guys spans 15 VISNs and over 70 VA medical centers, and it's really been a shining light of passion and purpose and impact here at Get Well. So just wanted to start by saying we are both grateful and inspired to work alongside of all of you. Last week, I had a chance to be with former Secretary Tony Principi at the Elizabeth Dole Foundation event honoring Hidden Heroes, which is our 5.5 million caregivers of veterans across the U.S. And I just wanted to also let you guys know it was an incredible night. And back here kind of in the lab, our R&D team is working on a project we call Care Circles here. It's kind of aimed at supporting caregivers as well. And so more on that on one of our community of practice gatherings in 2024. But we do a lot of work here as well with pediatrics. And so some of the same principles apply on this. And I just, having been at that event, thought it was really a really important thing that we think that working with you guys, we might be able to take on and tackle as well in the future. And then finally, I was so excited to see Bob Bott and Dr. Temple from San Diego on the agenda. Bob, thank you for hosting me last year on a visit out to your campus. We talked a bit about your Renaissance project, and I just got to say, just to see it, its impact, to see kind of the progress at the speed it's been, it's just a testament to the leadership and the culture you guys have created out in San Diego, and I just can't wait to hear the details. So I guess with that, just wanted to finish by just wishing all of you a happy Veterans Day in advance of next month's formal recognition. For all the veterans serving veterans, I hope you have an opportunity to step back for a moment and just soak in the appreciation we all have for you. With all that's kind of happening in the world, it's so evident how incredible your decision to serve was and how the sacrifices that you have made on our behalf are so meaningful to all of us today. So we are truly grateful, and I can't wait to hear the content today. So Carl, thanks for having me, and can't wait to kind of get on with the program. You're on mute.
Always a pleasure, Michael, and thank you for joining us today. I think we have two people controlling the slides. All right, so let's get on to the introduction. So our first speaker today comes to us from the San Diego VA Medical Center. His name is Robert Bott, and he is the Chief Veteran Experience Officer. And he is actually going to co-present with Trish Hall, his Client Success Manager, on the Renaissance Project and what they did and how they planned around maximizing the use of Get Well within the facility. So Bob, I'll hand it over to you.
All right. Thank you, everyone. Thank you, Michael, Carl, and everyone from Get Well and everybody else who's out there in the audience. Just real quickly, on behalf of Dr. Temple and myself, I wanted to thank everybody for being here and for allowing us the opportunity to represent VA San Diego and share with you some of the exciting work that we've done the past year related to Get Well Network. Kind of explain a little bit what the Renaissance is all about. That's kind of the key word that we had used for kind of our rebirth utilizing Get Well Network. But if you also would indulge me for just a moment, I wanted to take an opportunity to thank all of the staff here at VA San Diego for their amazing dedication and efforts. Without them, none of what I'm about to share with you would be possible. As many of you are other VA counterparts in the country, you know, we have a noble mission. We're entrusted to care for our veterans. And here at VA San Diego, we have an amazing group of employees who are very passionate about what they do. And to them, many of them, it's not a job, it's actually a purpose. And then lastly, I want to thank our Get Well Network representatives for their partnership and collaboration, specifically our Senior Client Success Manager, Trish. We've been working together for about 5 years now, I believe, and she is absolutely amazing. And again, without her, none of what we're about to share would have been possible either. So thank you to Trish. Next slide. All right, just a little recap about VA San Diego healthcare system. We're actually one of 8 VA healthcare systems located in Division 22, which comprises a good portion of the southern west portion of the United States. So Southern California, Arizona, New Mexico. At the picture you're seeing right there is a picture of our main medical center. We actually just recently renamed the medical center after Captain Jennifer Moreno. She actually was a Army nurse who gave her life in Afghanistan, rendering aid to her fallen soldiers. So we're very proud to be one of very few medical centers named after female. She's actually the first VA medical center named after a female woman of color. VA San Diego extends from across 2 different counties, San Diego and Imperial County. And it goes all the way from the border of Mexico, north about 75 miles, and then all the way across to the border of Arizona. We additionally, besides our main medical center, have 7 community-based outpatient clinics and in other different areas. You see them listed there. And we've been a partner with Get Well Network since 2013. We initially started off on having Get Well Network on really 2.5 of our units. And then over the years, we've now expanded. And just as of last year, we have Get Well Network now on every one of our inpatient beds. Next slide. So now we're going to be going on to our story. I believe it's the previous slide. There we go. Thank you. So just a little background. So as probably all of you had experienced, you know, during the pandemic, we really changed our focus, and it was really mostly on safety. So, you know, we wanted to make sure we cared for our veterans, and also our employees were safe. So a lot of our priorities and efforts were focused on that. So as a legacy site, we had, as you saw, had Get Well Network for about 10, at that time it was about 9 years. And we really hadn't focused on the user experience or really looking at what we can do to improve, you know, the utilization of the system, as well as, you know, feedback that we were getting from our veterans and our staff. So we decided that it was an opportunity for us, as the pandemic was kind of coming to more of a normal front, we wanted to get together as a group and really focus on how we can improve. So you see this slide here was kind of our kickoff, a slide that we had sent out to some key people, and we coined it a renaissance because it was really like for us a rebirth or a revival for us to really get back and can leverage the technology Get Well Network has to improve not only the experiences for our veterans but also the outcome of care. Next slide. So when we got together, basically the Renaissance included a lot of focus on, number one, bringing people together. So we identified a core group of interdisciplinary staff members, along as partnering with our Get Well Network client success managers. And we really wanted to focus on everything that Get Well Network had to offer. So we evaluated a lot of we identified first some of our focus areas, kind of the things we wanted to really evaluate. And we established work groups for each individual area of focus. So we had key members and subject matter experts on each of these different work groups. And it really did a lot of work. I mean, in the slides that we're going to share with you, it probably doesn't really represent all of the work and effort that went into it, but there was definitely a lot of effort put into it. And each group was charged with really doing two things. One, evaluating that particular area of focus and doing a deep dive and identifying what were the observations they had and coming up with some recommendations for improvement. And that was the charge that we gave out to each of the different work group leads and members. And ultimately, our goal, again, was really to focus on the technology component to it, as well as reviewing our processes. And once the recommendations were made, we turned it back over to Trish and her team, and they were able to implement a lot of the recommendations and changes that we had suggested. The next slide. So these were the areas that we really determined were our focused areas. The next slide after that. We broke them down into looking at the user experience, focusing on the priority spaces and favorite spaces page, as well as looking at the prompts and pathways. And there's a fifth one that's focusing on education. So we'll go over each of these. Next slide. And the next slide after that. So this is an example of what our favorite spaces page looked like originally. And you can see that we, over the years, we accumulated different tiles that we didn't review and didn't look at and, either just added on to them. And there were some that were outdated and really didn't have the information that we were looking for. And we really didn't have, I think, the priority areas that were mainly of focus, and things weren't really grouped together. So it was very difficult, I think, as we, observed veterans navigate through the system and then had our staff look at the content. We realized that we had some opportunities to improve the way that the system actually presented itself when our veterans first, logged on. So if you go to the next slide, these were some of the things that we kind of were focusing on. So how can we make it easier for our veterans to get the information that we want them to view, what they feel is most valuable to them, and make it easy and apparent on how to get to that information. So again, just to reiterate, as a legacy client, we had the system in place for many years, and we really haven't taken any proactive steps to evaluate where we're at. So this was kind of our focused opportunity to do that. Again, some of the information was outdated, and we needed to make sure that there was no risk to having that information be available to the veterans. So some of the challenges you're going to see in the subsequent slides are pretty similar. Obviously, we bringing our groups together. We had some team dynamics that we had to work with, and coming up with all of our ideas that the individual members brought and to come up with a consensus on what would be best. Of course, we did take the information back and have others evaluate it and experiment, kind of doing a little bit of trial and sharing some of that information with our veterans and asking them what they felt would be the most appropriate and best view for them. And the next slide kind of shows you what the result of the user experience group came up with. So there were some things we removed and added. We came up with the idea of kind of grouping things together that were kind of like tiles, putting them together. So again, if they wanted to search one thing, they could go to it, and that would kind of spread out to some additional content within that tile. And ultimately, we focus on what our priorities were and what the priorities of the veterans were. Next slide. I don't have a post slide of what the user experience looked like, but I can tell you, comparatively to the first example, the original way, it was much more cleaner of a look and grouped together better for the veterans. This is the prompt work group that we created, and this is what they were looking at. Again, you're going to hear some common themes about how easy it is for the veterans to get the information, and are we giving them the right content and information that will help them to have a better outcome. So again, over the years, we didn't have some consistent model for making sure that the prompts that were being added were evaluated over time. I think if I show you the next slide, a picture is worth 1,000 words. You can kind of get an idea about what we were looking at. So the top left there shows you all of the different prompts that our veterans were receiving multiple times throughout the day. So again, as a healthcare facility, we want to make sure our patients have an opportunity to rest and recover from the reason why they were admitted to the hospital. And having this volume of prompts was probably more disruptive throughout their day than it was helpful. So we wanted to make sure that we looked at each individual prompt. Was it something that was of value for the veteran or for what we were looking for? And if you look at the bottom slide there, you can see how we kind of narrowed the focus down of what was most important and lessen the number of prompts that our veterans receive on a daily basis. The next slide just shows you a different area of our unit, kind of similarly, how there were too many prompts before and how we limited the prompts after the evaluation. Next slide. So this one focuses on our pathways work group. Again, really focusing on the content that we had made available to our veterans, and was it something that they were getting a benefit from? Did it improve their safety? Did it provide them with knowledge? And did it improve their overall satisfaction? So again, some similar themes. We've had these pathways in place for a long time without any review to ensure that it was, again, the content was correct and it was meeting our intention. The other thing that we realized as we were reviewing the process was that, do we have the right people in place when veterans were completing the pathways and there were potential negative responses? Were those negative responses getting alerted to the right people? And in some instances, we realized that we weren't having any service recovery or follow-up happening after veterans responded to the questions a certain way. So that was part of our process review as well. So a lot of actions were implemented for this particular pathway. Dr. Temple, after this, my presentation is going to kind of highlight one specific area that I think captures in a nutshell how we were able to successfully make some changes to the pathways. Next slide. And lastly, we wanted to focus on education. Like I'm sure many health organizations, we have turnover over periods of time. And if you don't consistently have a good training process or pipeline in place, you're going to lose kind of the rigor and I think, some of the results of what we're looking for. So we really realized that we have an opportunity to kind of make sure all of our staff are trained on Get Well Network. There was a lot of focus on incorporating our Get Well Network champions and making sure that we had internal folks that were identified as being subject matter experts who could really, focus on getting the staff trained. So that was the main focus of this group. And then the next slide. So now we're going to show you some of the results of all of the efforts that we've conducted. So this one really focuses and highlights on, as we implemented some process changes and cleaned up, the user experience and the format, we saw a noted improvement in the number of videos that the veterans were not only receiving and engaging themselves in, but also completing. You can see that we've seen a steady incline over the course of the past 6 months. Again, a lot of effort and focus went into the processes and how we can utilize our staff. So across the board, we have an interdisciplinary approach. We utilized all of the care team to kind of reinforce the opportunity for veterans to be aware of the educational content and to encourage them to complete it. Next slide. Again, this shows some additional educational completion trends. Again, we got some opportunities to improve, but we have seen, again, some steady improvement over the last 6 months of getting a completion of at least one portion of educational that we've given to the veterans. And next. Okay, this one focused specifically on our fall pathway engagement. Again, we've really focused on what can we do to help decrease and prevent harm, and falls being one of them. So we have a group that actually focuses on this, and something that each one of our care team really focuses on. This is one of our goals as an organization, as each of our units, to have 0 falls. So education is a key component to that. Next slide. And I think this is the last one. This focuses on our discharge readiness pathway. This has been an area of focus. We have actually a discharge work group that really utilizes Get Well Network to ensure that the veterans are prepared to when they're discharged for home. So you can see that a lot of the pathway, even though the line looks pretty stagnant, we've seen kind of a correlation in some of our experiential data. So we have, again, a focus on what can we do to give them the information and have them alert us if there are things they have questions about, and preparedness for their discharge. So even though we've seen a little stagnation in the pathway completion, we have seen a correlation in some of the discharge results with our SHEP surveys. And I think a lot of that has to do with the reinforcement and education of our staff, to make sure that when they meet with the veterans upon discharge, that they, educate them, and again, utilizing our Get Well Network to be able to help do that.
Yeah, I just put this in here I wanted to highlight that all the work you guys did. One of the things that at Get Well we want to do is we also want to look at the things that we worked on that maybe we didn't make our goal. So this was one of the areas where we did a little work, but we obviously want to track it and see that we still have a little more work to do in this particular composite.
Awesome. Thanks, Trish. I should reiterate at this point that here in VA San Diego, our vision is to create 5-star experiences for our veterans and our staff. The journey is kind of our focus. So we realize that we're always focusing on how can we improve and how we can get better. So we know that that's not a destination. We're always going to be continuing to improve and evolve. So this is just one of those areas that we have, like Trish said, opportunities to do better. Next slide. And this one just highlights, so again, kind of reiterating back on how we've had a system in place before as a legacy site. One of them was our PXP questions. And we, again, had some processes in place, but with turnover, I don't think we had all of our leadership specifically in the nursing area aware of some of these questions that we were asking. So oftentimes veterans who responded to these questions, if there was a negative response, we didn't have a good process and system in place for the team to respond to do service recovery. We did a reevaluation during the Renaissance and decided that we had too many questions that we were asking. We wanted to narrow the questions down to things that were our priorities. So we did that, and we turned the Get Well Network PXP questions back on earlier this month or earlier this year in June, and now have a good process in place to, when a veteran responds in negative fashion, we're able to get our nurse managers immediately to get alerted and provide service recoveries. We see some good positive results from that. Next slide. All right, so now I wanted to just focus on one of the key projects that also came out of the Renaissance, and I'm going to be turning it over to Dr. Temple, who is one of our outstanding physicians in our hospital, and going to have him take over.
Thanks, Bob. Go to the next slide, please. So this project started a couple of years ago, I would say maybe 2 years ago, when I was watching Trish go through some of the slides and showing our data on, the number of CHF videos prescribed and watched, completed. She showed some data on that. Then she also showed data on our readmission rates, which were at the time were relatively high. It was a point of focus for our VA. And I was just kind of thinking, it was a pretty simple thought. I was just like, well, why don't we just really aim at providing and having the patients watch and complete more videos? And, might that have any effect on our readmission rates? Seemed like we had this great tool that we just weren't using. It seemed silly to me. So that's kind of how this all started off a couple of years ago. Next, please. All right. So busy slide, but basically in summary, that graph on the bottom right just shows our readmission rate over time, starting in 2021. And for heart failure specifically, it was roughly 21%. The best 10% of the VA is shown on the far right there in the darker purple. And that was like at least 17%. So we definitely were not at our goal. And so I said to Trish, I said, well, can we use this project as like a proof of concept, like where we try to really focus on getting these videos to patients and see if it actually has any patient-specific sort of outcome measure that we can impact, in addition to obviously the process measures of just completing and starting and finishing videos. I will say, in full disclosure, there was also an effort from a multidisciplinary team as well to kind of think about other ways in which we could affect CHF readmissions kind of during this time period. As well. But for this project, we had a multidisciplinary team that involves myself. I'm a hospitalist at the VA, been there for a few years now. I also worked with our chief resident in quality and safety in internal medicine, who I oversee. And then we had the chief of medicine. We had an advanced heart failure cardiologist and an advanced heart failure nurse practitioner. Oh, sorry. Of course, I also had a lot of input from informatics, and we'll talk about the intervention, but definitely needed to make some adjustments to the medical record, to the like CPRS, the electronic health record, in order to make this happen. Obviously, there was a lot of help from Trish and the Get Well Network team, I would say, really going above and beyond throughout this whole project to kind of tailor it to our needs. Really appreciate that. I know that we may have just been grandfathered in as far as like being able to customize pathways and stuff. So I really appreciate Get Well going the extra mile on that one for us. So our work group really had two main goals, and the goal was to go through all of the videos, which I'm not sure if you guys have sat down and like seen all the different videos that are available, that we can order. So that there was a change in vendor from the legacy one to the current group that made the videos. I think in general there was a big step up in the quality of the videos. But we sat down and we went through every single heart failure related video, and we wanted to make sure that it kind of spoke to what we wanted the patients to hear from us, essentially as an extension of what we would want to say to them if we had the time to do these things like face to face. And so we curated, I believe it was 7 or so videos out of like the scores of videos that were potentially available. We're talking about diet and salt intake and weighing yourself and the heart failure, like goal-directed medical therapy, stuff like this. So we came up with a series of videos, and we had a series of prompts, occasionally prompts like, do you know what a low sodium diet is? Or, do you have any concerns about your access to be able to get like heart healthy foods? And actually when they click on those buttons now on the Get Well network, I get an email telling me like which patient bed and room had that question. It's fairly rare, but when I do get it, then I can reach out to the medical teams and say, hey, so-and-so in this room has this question. Can you kind of loop back to the bedside and talk to them about it? So that was the main idea as far as coming up with this pathway and making it very user-friendly and focused and high yield, and not having a bunch of like superfluous information. So that was the bullet point 1 there. And then the second one was like, well, we asked ourselves, actually I had to be honest with everybody. Physicians, at least previously, physicians didn't spend a lot of time thinking about and ordering Get Well Network educational videos. It just wasn't part of our workflow, and that's unfortunate on one hand, but what we were trying to do is figure out ways in which we could make it like automatic. So how could we, like at what stage in our workflow would it make sense to connect this order to launch the pathway, in how we treat a patient with CHF? So we gave some thought to that. I think if we continue on to the next, we can kind of get into that a little bit. Okay, so we wanted to use have a trigger to launch this pathway, and so we kind of talked about a lot of options. We were like, well, can we link it to like IV diuretic doses, because that perhaps is one thing that any patient coming with CHF is likely to get. And that got a little bit complicated, so we decided to bail on that one. There was, of course, other people that just still wanted to be the manual, find it in the order menu and order it. But then actually, full credit to Joe Wynn, who's a pharmacist and also an informatics expert. He said, well, why don't you link it to your telemetry order, but specifically the one that's for acute heart failure. So like if you look at the middle of the screen, the 4th one down, if a patient comes in and they order cardiac telemetry for a patient, for the indication of heart failure, then this order, you can see at the bottom below that, it says GWN education. It will automatically like launch this pathway with it. And then just making that relatively simple but very thoughtful change, the number of like videos we prescribed in these pathways went up like astronomically. So I think it's really important to think about like the human factors involved in the process. And on the right there, it says, we started this on April 1st of 2022. And I can carry on. Yeah, and so we don't have a whole lot of free data as far as like completed CHF education videos, but you can see from Q2 of financial year 2022, like it was basically non-existent, like fewer than a handful of heart failure related educational videos that were prescribed in any given quarter, which is again, the first thing I said was really unfortunate because we had this great tool that we just weren't using. And so you can see there was a brisk kind of uptick in the completed educational videos after we kicked this off. And then kind of going on, you can see how we've had, at least in the yellow line there, we've sustained like these videos getting prescribed to patients. And I think just in general, like when I'm on the wards, I'll often like look and see if the heart failure pathway was prescribed, and it often is appropriately. So that's working really well. And then most importantly, and I will also give it the caveat that we had some other focuses as well as far as our interventions for readmission rates. But you can see like a really significant drop in the number of readmissions by quarter for heart failure from where we were around 20-21% down to closer to like the national average of 17%. And I would like to think that these videos help patients become more empowered and be able to manage their CHF better. One thing I forgot to mention is that we also paired these educational videos with like a color-coded like a weight log and symptom manager that tells patients like what they should do when they're having certain symptoms, you know, whether it's call 911 or take an extra dose of diuretic and stuff. So we actually made some printed out like materials for them that are actually shown in the pathway, but then they also go home with as well. So I really feel like patients have a much better grasp on how to manage their CHF now. So you can see there was roughly a 20% decrease in readmissions at 30-day readmissions, which was huge for us. I'm not so sure how many of you watched the show Welcome to Wrexham, but if you have been watching this season, on the bottom right, there's a quote I wanted to include that says, "Don't forget to sing when you win." Because I think a lot of times we do things in this is an example of where we did something, and I feel like we've had a significant positive impact. So I'm really glad that we're celebrating it. Kind of gives me more energy to want to move on to the next thing, and that ties in with our relatively new executive director at our VA. So, well, can we replicate this type of process for more of our patient populations beyond heart failure? So I think that there's a lot to come as far as like having really thoughtful integration of our clinical workflow with how we get this education to patients. And I'll just open it up to the group if you have any questions about the pathway or the process we had or anything like that.
Thank you, Dr. Temple. I'm looking in the Q&A box right now, and it looks like there was 4 questions asked, and they've already been answered. So I don't see any for your presentation. So thank you very much for sharing. This is great and exciting, and I do know that the folks on are going to be looking at this as a best practice, and hopefully we can replicate it across the board to all of our VA partners.
Yeah, we also actually did a similar thing. It's not quite as robust as this one, but we tried to loop in a COPD pathway as well to the to an order for continuous pulse oximetry. So I would just throw that out as another example, another idea for folks to think about how they can cleverly kind of integrate the orders into our workflow, like I said before. Looks like there may be
Awesome.
another. Is this something that can send videos to outpatients? That was a question. I believe that's where the Get Well network loop comes into play, if I'm not mistaken. And I think that's a work in progress and coming on the horizon.
Yes, that is correct. So Michelle, that would be the Get Well Loop product that would be able to reach outside the walls of the hospital. And we have 350 different care plans that are embedded into that product, heart failure being one of them.
Yeah, as a side note, I'm actually really excited about when we're going to get FedRAMP approval and get that going, because it'll be great to not only have education during the hospital stay, but then have it a week, 2 weeks after when patients are at home recovering, and at that point having real questions that they need answered.
Yeah, we were awarded the FedRAMP ATO or the VA ATO just a couple of weeks ago. So we're ready to move forward with anybody who's interested in leveraging Loop, for heart failure or for any other pre or post procedure care plan that you would like to leverage. All right, cool. Next up, I have Paul Hughescamp, who is our Senior Vice President for Government and International Markets, and he is going to walk through and give us the latest update on the 2 VA memos that came out recently and how Get Well Anywhere Federal kind of plays into them. So Paul, go ahead and hand it over to you.
Thank you, Carl. Next slide, please. So if you haven't seen the memos, here they are. And we were not aware that these were coming out. So we have been talking with the VA central office about the meaning of these memos and can we get some clarification. And really what the memos are applying to is connecting our historical inpatient system to Oracle Cerner. And they're not applying to our current on-prem connection to Vista CPRS or, as Carl just mentioned, our authority to operate in the cloud with that same connection. So again, it's only inpatient with the on-premise system if we were to connect to Oracle Cerner. All of this really got started when we were trying to help our client, the Spokane VA, with an on-premise deployment, get connected to Oracle. So this goes back to 2021. We have since made encryption layer additions that we believe would allow that connection. But with what the VA is doing with Oracle Cerner is they're really trying to do enterprise-wide deployments. So what that will lead to is the cloud deployment that we are now available to provide under our FedRAMP authority to operate. So again, this is all Oracle Cerner. We all know that there's no current deployment schedule for Oracle Cerner. There's mentions that the process will start again in the spring at the Level federal facility. But beyond that, there's really no known deployment schedule for Oracle Cerner. So in the August 17th memo, there was also mention of this national evaluation of patient engagement platforms. We have been actively participating in that. And I'll submit to you, we know of no other patient engagement system that has the authority to operate or the MOU ISAs from the Office of Information and Technology to both deploy on-premise or in the cloud. So next slide, you'll see we do have our VA authority to operate in the FedRAMP environment. So where we're at with this is VA has blessed it. These are the actual ATO documents that we can work under within the VA. And that FedRAMP package now sits with the General Services Administration, who has to review it and bless the final package so we can use this same authority across all federal agencies. So there's a queue at GSA to get those packages through. Ours is in that queue. So I'd ask you to consider, as you're looking at Get Well and our readiness for this, there's a huge investment of resources and time and expertise in meeting these cloud security requirements. And we've got the ATO at this point. So that's one big piece of evidence that shows that we are ready for this next evolution of electronic medical records in the VA. And then on the next slide, you get a little bit of a glimpse into our current MOU ISAs. So the VA Office of Information and Technology has issued these, one for our cloud environment and a second for our on-premise environment. So again, I just ask you to consider all of that and the fact that, as Michael said earlier, we're now in over 70 VA medical centers. We're in 15 of the 18 VISNs. We have all of this investment and authorizations to do the work. I believe we stack up better than any other organization who could provide a similar system to the VA. And we'll continue to play in that national evaluation process so we can see how all of this plays out. So I'd like to turn the ball over to Robin, our CTO, who'll give you a view of our federal cloud environment and talk with you about the benefits of converting to the cloud from the on-premise process that we currently offer. Robin?
Yeah, thank you, Paul. So hello, everyone. I'm Robin Kavanaugh. I'm the CTO for Get Well Network. And I really wanted to just give you a really high-level overview of Get Well Network Anywhere Federal as deployed in Amazon GovCloud. And to start with that, I just wanted to quickly lay out what going into a FedRAMP certification process is and why deploy in the cloud. So as you know, the FedRAMP certification process is really about, as the name suggests, creating an on-ramp to allow federal agencies to consume services that are deployed in the cloud more easily by sort of pre-vetting a lot of the security controls and operational controls to ensure you're sort of following the best practices that the VA and other agencies are requiring of systems like that. And so over the last several years, Get Well Network has done exactly that. We have been re-architecting and taking our components and our capabilities and pushing them up into Amazon GovCloud, where all of our services are hosted in this sort of red boundary box that is on this diagram here, and really created a central mechanism for all individual sites, all the VISNs, all the VAs, and potentially in the future other agencies as well, to be able to connect directly to those cloud services that we are offering without having to deploy individual servers or individual systems at those VA sites in order for them to take advantage of it. This allows all of the capabilities that we've been talking about. Of course, the inpatient services that deliver services to veterans at bedside, but also adjunct services like our rounds plus service and our loop services that allow you to offer care pre and post hospital stay in a number of different ways to promote compliance, to deliver education after discharge, to prepare people for surgery, and frankly, to allow people to access this information on devices that are outside the hospital, like their own personal devices. And so all of those capabilities require that you're deployed into a cloud environment. And so that's what we have been working through, and that's what we have submitted, as Paul mentioned, with through the FedRAMP board, and is now being reviewed for its final approval through GSA. Once that is in place, directionally, what we would like to see is that all of the individual VA sites and deployments that we have today will migrate to this cloud environment. And by doing that, we will be able to have a whole slew of additional benefits that supplement the capabilities and services that you have today on the on-premise version, and offer and sort of unlock a bunch of other capabilities that we can offer in that cloud environment. So we've done all of the sort of hard work behind the scenes to prepare this environment, to create all the documentation, to create all the procedures, to control, to address all of the security controls that the federal government requires in order to make this available, so that we can now take advantage of it quickly, regardless of where your VA happens to be located. So we're going to continue down that path. And for those of you that are already inpatient clients or are already consuming Get Well Network services, I just wanted to go through a few of the benefits about what will happen as you migrate into this cloud environment, and what benefit it has to both you as the facility as well as to the veteran. So if you go to the next slide for me, I will just walk through some of those. So probably the first one that's of import is that by going into this cloud environment and connecting to VA at the national level, what we get to do is get sort of shared integrations across multiple VA sites. So a single set of integrations for authentication, so that you can authenticate with your own credentials without having to have each site do their own integration individually. The same thing for data that's coming out of VISTA or CPRS, and being able to take that content, get it directly from those clinical systems, and then route it out to all of the products that are encased in the Get Well Anywhere Federal, whether that's the inpatient solution, the round solution, the loop solution. One interface to sort of serve them all is the idea. Of course, there's configuration that needs to be done at each of those for the different VAMCs that need to consume the services. But it's great simplification on how to get that data across. The second piece is that it opens up the ability for us to use mobile devices, both while you're in the hospital as well as when you're not in the hospital. So as we all know, people's mobile phones have become integral to their own lives, and we use them for everything from ordering food to watching video content. And this should be no different than that. And so in the Get Well Anywhere Federal model, we do, as part of that, have the ability to have people use personal devices to access the same set of content that is in that inpatient environment. So a video prescribed to the veteran lying in the bed they can consume it on their personal device as well as on the television in the room. So it really opens up a bunch of capabilities. And when they leave, that education can be made available to them as well when they go. We have a ton of reporting and data visibility that is taking place in this cloud as well. Some of the data that was shared earlier by Dr. Temple, those reports and graphs about like utilization trends and activities over time. We've done a lot of work on the reporting end to be able to expose those as dashboards to all of the people that need to see them within your VA environment. And so you can get onto those dashboards, see what's going on, understand how our products are being used or how you are deploying them within your facilities, and make some adjustments to drive utilization further. Of course, because it's in the cloud, you get to consolidate resources, so deployment into new sites becomes easy. You want to turn on a clinic over here, or you want to turn on a new facility. There's just less work to do in those sites to be able to consume them because all of the core has already been done for those for those services. As part of the mobile engagement on people's personal device, SMS or text messaging engagement has also been a big part of this. This has been included in our FedRAMP boundary, which means we can actually actively text and interact via text with the veteran population through that platform as well. So that opens up that possibility, which is not possible on the current inpatient on-prem solution. We're also receiving a whole slew of additional data from the clinical systems as well, which what that means is that we can actually personalize the experience further for the veterans who are actually consuming the experience. Today, for a lot of technical reasons, we actually hide and obfuscate a lot of the information that we're getting from the EHR because we can't show that safely in that environment. In this cloud federal environment, that is opened up, and you have more ability to say why we are showing content to the various people. Rounds integration becomes more advanced. We're able to drive the same the surveys and keep the surveys in line with what is happening in the inpatient setting. So the same data that we are receiving on an inpatient PXP or inpatient survey can be tied directly to the Rounds Plus survey. So it keeps all of that data linked together. And it also opens up the ability to use this outside of the traditional sort of bed locations. So in places where you're not necessarily bedded, hallways or emergency rooms, we have emergency room experience or emergency department experiences that are also available through the BYOD. So a ton of advantages into moving this that are really supplemental to what you already have on the inpatient solution. And of course, the additional security controls that come with being a FedRAMP authorized environment. So again, we are going to continue to share our progress as we move through that, as we get our final certification from GSA. And we are going to be working with you all who have existing sites about what the process is to get you onto this, this instance of it, as opposed to the one that you have locally at your facility. And I think that is all from my slides. And I think there's an option for questions if anybody has.
Robin, yes, we have one question from Jay Allen. His question is, I would presume that any and all cloud-based implementations would also improve the veteran experience insofar as if the veteran is traveling or moves out of one area of care, that there would be a seamless, or that it would be seamless across their EHR treatment plan in the facility where they end up. Would that also be an expected benefit from moving to cloud?
Right. So today, if you are a veteran in facility A and you're receiving Get Well Network services and content and information, and then you, for whatever reason, leave and you go to facility B that doesn't happen to be a Get Well service, you've kind of, your access has been restricted because you have no way to see it on your own personal device. But in the BYOD model, that same content would be extended, and you'd be able to have that same content available to you on those devices when you want to see those things. So yes, definitely another benefit to it.
Awesome. And I don't see any more questions in the question and answer tab. So thank you, Robin and Paul, for your presentations this afternoon. Very helpful, and hopefully this helped answer a lot of the questions that are still out in the field from those two memos, and in our ability, to continue to be able to serve our veteran population. So that completes today's webinar. Thank you all for joining today, and thank you all for sticking with us for the full hour. I know it's very difficult to take an hour out of everybody's busy schedule. But this is probably my favorite time of the year, is when we celebrate the work that our clients have done. And as you can see, the San Diego VA Medical Center has made some outstanding strides in really maximizing their investment through the use of Get Well, to not only improve education and completion of education, but also the return on investment impact of reducing heart failure readmissions within the facility. So when you close out the webinar, please take a few minutes to complete the short survey that popped up on there. That helps us with future planning of webinars, and it also helps to make sure that the message we were intending to portray today, we actually portrayed. But thank you, everybody. That completes the webinar.
That's all.
You.